This question is for the Premier. Speaker, we're just weeks away now from an approval for the COVID-19 vaccine for 5 to 11-year-olds. Parents, meanwhile, are still waiting to see a plan. The science table said we need a clear information campaign, school-based clinics, and an equity-based strategy to reach those at-risk communities. But we haven't seen any of this from this government. Nothing. Meanwhile, provincial data show that vaccination rates for the 12 to 17-year-old group are lagging behind. Speaker, we cannot afford to get this wrong. When will the minister stop asking parents to just trust her and show people an actual plan to get kids the protection of a vaccine?
Minister of Health.
Thank you. Well, I thank the member very much for the question. In fact, a great deal of work has already been done on the vaccination of children aged 5 to 11, because we anticipate that there will be approval very soon from Health Canada, and the vaccines are all ready to go, and we are ready to provide them. We have been working, Dr. Moore and his team have been working with their 34 local medical officers of health for the delivery of vaccines within their communities. This information will be available very shortly to parents, because I do understand that parents want to know what's going to be happening in their local geographic area. We do know that parents of young children that are 5 to approximately 7 years of age would like their children to be vaccinated either by their family physician or pediatrician, whereas for older children, the parents are happier if they could be vaccinated perhaps at pharmacies or at larger vaccination clinics, or perhaps pop-up clinics. There is a detailed plan in place for each geographic area. That is going to be forthcoming very soon to answer parents' questions.
Supplementary question.
Premier, back to Speaker, I'll send this back to the minister. The minister says that they're ready to deliver this vaccine plan. Well, tell that to the parents who don't know where to register their kids yet. Public health units are doing great work, but the government is dithering and dathering and delaying, and anti-vax activists are filling that silence. We're risking losing people to misinformation. Families in British Columbia, on the other hand, have been able to pre-register their kids since early October, giving them incredible peace of mind and early information to prepare themselves and their children. As of last week, over 70,000 children in British Columbia had pre-registered for the shot. Where are we? Speaker, why won't the government take this simple step and get things moving so we can all get out of this pandemic sooner?
Government side will come to order. Minister of Health to reply.
Thank you. In fact, we are ready to go. We are in a very good state of readiness. We have had detailed discussions with the local medical officers of health and with Dr. Moore over the last several months to be prepared, because this isn't just a simple matter. We want to make sure that we can prioritize to the 5 to 7-year-olds. We also need to make sure that 5 to 11-year-olds, pardon me. We also need to make sure that we're able to do the third shots for people who are over 70, immunocompromised people, and the rest of it. All of this is organized. All of this is going to be communicated by the local 34 public health units very shortly, so that parents can start pre-registering their children, making appointments with their family doctors, because the plan is going to be different in each of those units depending on where they are, whether a school is going to be the more convenient location to vaccinate children, not during school hours, but when their parents can be with them. We have a plan. It is going to be communicated very shortly and is going to be provided in due course for parents to be able to make their own arrangements that they see appropriate for their own child. But we are ready to move immediately on this.